Have you seen one of the latest beauty trends online? Surgery to permanently change the color of your eyes to shades like jade, French blue, and honey gold.
I'm in shock.
Raquel Ballesteros relied on colored contacts to get the gray eyes she loved. But when she saw an ad like this on Instagram,
your dreamlike color is just a blink away.
She decided to pay $12,000 to get keratopigmentation surgery to permanently change the color of her eyes. A doctor uses a laser to carve a channel into the cornea, then fills it with a colored ink.
Today is the day. It's the day I'm going to say goodbye to my brown eyes.
We were there as Raquel underwent the procedure at this New York clinic run by Dr. Alexander Movshevich. First, some numbing drops, then the laser, and finally injecting the ink. After 40 minutes, it was all done.
Very, very good. No pain, and with the blankets, everything was comfortable. Amazing, incredible.
Dr. Movshevich advertises the surgery to his 260,000 followers on Instagram. He says in 5 years of performing keratopigmentation on more than 1,000 patients, no one has reported serious problems. What kinds of complications have your patients experienced?
Not many. They have some discomfort, about 24 to 72 hours.
But in November, the American Academy of Ophthalmology issued its second warning, urging people to avoid this surgery for cosmetic reasons, citing risks that include cloudy vision and even vision loss due to infection.
I've scrutinized all the data.
AAO spokesperson and ophthalmologist Dr. Christopher Starr says there isn't enough data to support the safety of keratopigmentation to change eye color. It's only FDA approved for patients with corneal defects. If it's safe for medical reasons, why isn't it safe for cosmetic reasons?
That's a good question. You do an invasive procedure like this in a healthy seeing eye with no problems at all, that is a weakening of the cornea.
The procedure now has a 15-year track record, and to me, that's shown that it's been safe and effective.
Cornea specialist Dr. Brian Boxer-Wackler says the procedure has been performed in Europe for more than 15 years, and he's done it on hundreds of patients at his Beverly Hills practice. He and Dr. Movshevich joined 2 other ophthalmologists in writing a protest letter calling on the AAO to retract its warning. What do you say to people who think this is a perfectly legitimate procedure for medical reasons, but when it comes to cosmetic purposes, it's an unnecessary risk?
I think that we see this mindset even with other procedures such as LASIK. In the beginning, so many doctors were saying, why would you operate on a perfectly healthy eye? They can just wear contacts and glasses. So there's a mind shift that has to take place for a lot of doctors that aren't used to working in a cosmetic space.
As for Raquel, beauty is in the eye of the beholder, and she says she's happy with what she sees.
I love the eyes. I love my face with these eyes. So wonderful.
Now, if you are considering this surgery, the AAO says get multiple opinions first and ask questions so you really thoroughly understand the risks. They also recommend talking with your eye doctor and getting a prescription for colored contact lenses first, but be sure to buy them from reputable sources. There have been some reports of people getting infections from unsafe contact lenses that they have purchased online. So, you know, there's a lot going on with the eyes and people wanting to change the color of their eyes, but you got to do it in a smart way and a safe way.
As Dr. Ian Malcolm said in Jurassic Park, just because you can doesn't mean you should.
And we'll leave it there,
Al. Well said, Al.
Yeah.
Vicky, thank you.
Okay. Yeah.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.